So my name is Dr. Alex Leff. I'm a consultant neurologist and a reader in cognitive neurology here at Queen Square. My interests are in coming up with therapies and ways of making those therapies available for patients who've had acquired brain injury. So patients who've otherwise been normal, they've had some kind of brain injury like a stroke, a head injury or brain tumour that has caused them to have problems with some part of their cognition, which is basically thinking skills. And the things I'm going to talk about today are patients who have trouble with their vision following their brain injury. The thing I'm particularly interested in is making behavioural treatments available to patients who've had acquired brain injury, such as stroke, head injury or brain tumours, and getting these behavioural therapies for them to use on the internet. So we've got a couple of therapies going at the moment. One of the things we know about the therapies is they're very specific. So if you practice a specific type of behaviour, it will improve your performance pretty much only on that thing itself, but it won't generalise to other behaviours. These two therapies that I've been working on are for patients who've got a visual problem, what's called a hemianopia. In other words, they've had some damage to the back part of the brain, which is where the visual cortex is, and they either have a problem seeing one side of the world or the other. So information from one part of their visual field or the other is damaged, and so they're missing that information. You can still get by surprisingly well even with half the information missing because you move your eyes, so that's how you see, is by moving your eyes around. And what both of these therapies do is they induce a specific type of eye movement which helps you with certain types of visual tasks. So one of them, for instance, is for reading. It's a website called Read Right, and there's some stimuli on there which entrain a certain type of eye movement. And if patients practice enough with that over time, when they go back to static text, their eye movements for reading the static text become more efficient. Now, that therapy has never really been available for patients to use by going to a therapist, say on the NHS, but even if it was, there's not enough therapists around for people to do that. So kind of big idea, if you like, is to get these therapies in packages or apps where they're very patient friendly, and people who perhaps aren't hugely technology savvy can log on, download the app or interact with it and start using the therapy, so that they can basically get on and do the therapy themselves when and where it suits them. These conditions are relatively common, so the commonest cause is stroke. As I said, there are other causes: head injury, brain tumours. People who've had surgery after brain tumours often have this problem, hemianopia. And so there are almost certainly in this country alone tens of thousands, if not hundreds of thousands of people who've got this problem, the hemianopia. And unfortunately, although I'm a big fan of brain plasticity, the visual cortex, which is responsible for high acuity vision, is not very plastic. So once that's been damaged as an adult, even in the first few weeks of life, it's been shown, unfortunately you can't regain that function. But using these compensatory techniques which induce compensatory eye movements, you can improve your visual function, even though you can't improve your visual field. As I've said, there's loads of people who've got these problems, not just within the UK, obviously throughout the world. And by making the therapy available using the internet, and anybody who's got an internet connection or a computer can effectively access the therapy. So it's really about access. So the original idea with these web therapies was just to really put them out there so people could use them. Certainly the Read Right one that's been around for a bit longer. The other one's called Eye Search, which helps a different type of eye movement, which you need to find objects, so say in a busy room or a busy desk, or when you open a drawer, or on a computer where there's lots of things going on, you have to sort of move your eyes around to find things. And patients with this problem, hemianopia, have problems with that, but it's a different type of therapy, it's a different type of eye movement. Initially the idea was just to put these therapies on the web so people could use them, but then sort of thought about it and thought, well, if we're going to put all the effort into putting the therapies on the web, don't we also need to put some tests to see if it's working? Because although they're free to use, we don't really want to put something out there that we don't know if it works. And even though the therapies have been shown to work in academic institutes or clinical institutes like these, where the patient comes and interacts with perhaps a therapist who has the program, this is a different question. It's the patient doing it themselves via the internet. So that itself becomes an empirical question, in other words, a question we can answer. So in order to do that, we have to put in the baseline tests. So before the patients can get to the therapy, the eye movement therapy, we do measures of their visual fields, we do measures of their visual search behaviour for eye search, or their reading behaviour for read-write. Then they do the therapy for a set period of time, and it's up to them how long it takes them to get to that next milestone. But when they get to the next milestone, they then go back and redo the tests again, and so on and so on. So each time they do a chunk of therapy, they get retested. They do another chunk of therapy, they get retested. And then, of course, we can do statistics, simple statistical tests on that data to see if, in fact, it's working or not. And certainly for the read-write website, which has been around a bit longer, we've published on that, and we've shown that we can improve people's reading speeds by about 40%. And on the iSearch website, we've got some really interesting findings, and it looks like that's working too, but it hasn't been published yet. So we really need to get those results out to peer review, because that's the way that you test really whether something is believable. It's not just whether you believe it yourself, but whether you can put it into a paper and convince other people that what you've done is technically sound and you've shown the right thing. So that's really the stage we're at the moment, is proving that it works. And certainly for the read-write one, we've got effect sizes which are roughly where you'd expect them. In other words, they're about the same effect size as you would get if you were coming in and practicing the therapy with a therapist there.